I think most of you will be familiar with Together for Short Lives, but just for those of you who maybe aren't, we are the leading UK charity that speaks for children and young people who are expected to have short lives. We work with those who provide services who care and support these children, and we're here to help them have as fulfilling lives as possible and the best care at the end of life. And transition has really been one of our key strategic priorities over the past 4 years. We've been working through the UK Transition Task Force to build awareness and support the development of services for young adults with life-limiting and life-threatening conditions. And we very much see these webinars as an extension of that strategic priority. So today's webinar, after this little welcome, we'll be hearing from David Strudley, who's going to talk to us, give an overview of transition and the approach of the task force. We'll then have plenty of time for a Q&A session after that, and we'll be wrapping up at about 25 past. I think most of you will know David Strudley. He doesn't need much of an introduction, but he is currently interim chief executive at Rainbow's Hospice for Children and Young People, and prior to that he was chief executive of Acorns Children's Hospice. David's been the chairman of the UK Transition Task Force since its very beginning in 2013. I must also just mention at the very beginning a big thank you to the funders of this webinar series, the James Tudor Foundation. So I'm going to now hand over to David, who is going to talk to us about stepping up to transition.
Thank you, Lizzie, and good morning, everybody, or just good afternoon now. And fantastic to see so many people have logged into this. And I just hope the technology keeps up with the enthusiasm that's been demonstrated by that. And my aim this morning is to, as Lizzie says, is to give you a sense of the way that we're actually going ahead with transition through the context of the Stepping Up Guide. And it's worth starting by saying that in the guide, was published, now it seems extraordinary, but it was actually published in 2015, and it still remains the definitive publication, I think, of enabling a good transition to adulthood for young people with life-limiting and life-threatening conditions. But in that introduction, Lucy Watts, who's now 24 years old, Lucy Watts MBE, and has complex life-limiting conditions, indicates just how scary and confusing transition from children's to adult services can be, and certainly proved to be for her. She says that young adults must leave the people, the teams, and the services they've built up with their trusting relationship and they have to leave them and move instead to new specialists, new services, and indeed a different system with an unfamiliar approach. In such circumstances, I guess it's hardly surprising that, as she says, it seems daunting and the number of changes can be overwhelming. To make matters worse, it can all happen without any bridge between the two service provisions. Lucy, for example, was discharged from a paediatric ward on one visit, and her next hospital admission was onto an adult ward with 5 other elderly dementia patients. Worse for her, she also found that she was suddenly expected to make decisions alone, when only weeks before her mum had been at her side supporting her through any of the medical decisions that had to be made. And so in this series of webinars, our aim is to remind us of the issues faced by young people in transition, and to provide what we hope will be practical advice to support the implementation of the 5 standards and the 30 goals of our Stepping Up framework for transition, and give you an opportunity to share reflections from practice and on ensuring that young people's experience as good a transition as we can make it and have support to settle into adult life. And my aim today in this short presentation is both to introduce the task force and first the Stepping Up Guide in the context of the issues faced by young people with complex needs in transition. What we'll do as well is ask you after the webinar is over, Lizzie will send a survey monkey about the way the webinar has actually gone, but it will be really helpful to know to what extent you're actually using this guide, and if, having heard what it provides, if you're not using it at the moment, whether or not you might wish to be doing so in the future. So let's first think about the actual issues themselves that are faced by young people and indeed by their parents and carers. And I hope you've got this chart in front of you now, and just quickly to run through some of the things here that are on the list. The first thing, of course, is that we're worrying always about how to bring up our children. And of course, there is a extent to which, in this situation, because of the nature of their conditions and so on, we tend to hugely overdo the business of concern and looking after them for all the right reasons. We're now thinking, is independence possible? What about their friendships? What about the relationships they may have with one another? How about intimacy with partners, for example? And a number of other things too. The most frequently raised in focus groups and so on is that the information they feel they need to be much more easily accessible and more easily understood. They also want to talk about education, and indeed we include in that, of course, vocational training. But they also, some of them, actually need, right from the very beginning, the development of life skills that otherwise they might not have. The business of suitable housing I'll come on to again a little bit later, but certainly that again also turns out to be the sort of thing that they particularly want. But more than anything, with parental support if requested, they want to be involved in decision making. And you can see the other things that are there too. And from my own point of view, the development of advocacy, the inclusion of key workers, and having someone to provide emotional support, a trusted professional who can talk about the issues such as end-of-life planning when the time is right for them. As far as their parents and carers are concerned, an equally demanding list presents itself. And you can see the sort of things that are covered there. The most important thing at the beginning, that we move to person-centered working across all of the agencies, and that those agencies themselves are better educated in exactly what it is that makes up the complex nature of the conditions affecting some of the children they're providing services to. Actually, we also still feel that there is a need for greater understanding of the process in healthcare, especially we find in hospital settings with a more dedicated adolescent approach, including, of course, the provision of units where it's possible. The business of acknowledging the needs and wishes of young people as they approach independent living and what that all means for them. For some are going on to university, to others into the world of work, but they want to be able to express their needs and have them acknowledged and responded to. How we as professionals, all of us, wherever we may be, speak to them and listen to them is also of critical importance to them. And that is emphasized again and again in the focus groups with parents and carers. And the other things you see there, the whole business of multi-agency teams, for example, beyond the short breaks that have been mentioned by the children themselves. And actually having a much simpler funding scheme, which actually joins up education, health and social care, both budgeting, whether aggregated, and the actual business of funding. And the provision of as good information as possible for young people so that they know where support will come from as they progress into adulthood. And so back to the overall guide itself. And what I'd like to do now, if I may, is to move on and look at some of the business of the phases that are necessary for them. And again, the guide is absolutely super in the way that it expresses it, but I'd just like to pick up one or two points that might be helpful. So let's look at those phases if we could. And bear in mind, as we do look at those phases, that the thing that is most important about this is that there is also very much so a guide that enables us as well, attached to the Stepping Up guide itself, an audit tool that you can access on the website that enables you to, with the young person concerned in your professional life or whatever it might be, to see exactly where you are in the scheme of things and how well it's all going. And together those things, those two documents make up a really helpful and comprehensive guide to how to take us through these. But the three phases: first, preparing for adulthood between 14 and 18, preparing to move on from 18 through to 25, and the whole business of settling into adult services, absolutely critical. And so the first element of this then, which is phase one, you see there, that is the standard. There are 5 standards in all. The first standard applies to phase one and includes things like the first start at parallel planning. The whole business of initial conversations needs to start here, so that we start getting a sense of what the young person actually wants, what the young person actually intends to do, and how he or she like to approach it, whether it's through further and higher education, whether it is simply being able to enjoy life to a greater extent, or whether it is actually the whole business of the world of work and independent living. And I should say, as we're thinking about this, of course, that we must never forget those wonderful young people that we also look after who are cognitively impaired and for whom these sort of changes are going to be going on without their active participation in so many ways. But in thinking about all of this, the follow-up meetings, the multi-agency stuff, all need to be taken account of in order to see us through standard one. So that's phase one. Into phase two, which is the whole business of actually moving on. That's lovely. And here we are with the 3 standards here for phase two. And I'll let you quickly absorb those quickly before going on. In standard 2, first of all, the most important element of standard 2 is this move from family-centered work and planning to young person-centered care. This is a critical stage in the development. And we would all accept, those of us who've been involved in this business for a long time, just how much we protect our young people while they're still in our care, and how perhaps we even wrap them up a little bit in cotton wool, and how this is such a critical element where they move from family-centered to young person's care. This is where, therefore, it is so critically important that a key worker is made available and actually works to build those relationships, make the links necessary, actually conducting the necessary advocacy to enable the other elements, which are that of future planning and identifying the precise nature of the specialisms in adult service to whom the young person concerned is to be referred. And all the time, making sure that the young person not only is at the center of all of this, but is actually the person who's actually indicating what kind of things with mum and dad and other carers he or she actually is looking forward to in the future. In standard 3, we make a clear requirement right from this time of moving on that we plan for end-of-life care, which must be developed in parallel. And in fact, in a later one of our webinars, Dr. Emma Husbands will be talking about exactly how that works in practice and why it is so terribly important. But for the time being, we need to say, as well as making plans for that, even in times of uncertainty, even when a young person may not be at all well, we still need to continue planning. And you can see there that the standard itself, therefore, applies to all stages of the journey, right from the very beginning at the age of 14, all the way through to the moment when the journey comes to an end. But it only comes to an end, of course, for the young person concerned. At that point, the post-death support to all family and professionals involved is absolutely critical too. Which is why we say in Standard 4, the need for the children's and adult services actively working together becomes a critical element of this too. So we'll be planning for the specific needs of each individual and making sure that we have an ongoing review scheme that takes account of their needs, and that everybody is actually involved in this. And we've got marvelous examples, and Leah will be talking to us at the next webinar of exactly how those three standards have all come together for her. But she's not the only one, of course. There are many others, including Lucy Watts, to whom I referred at the beginning. Chris Edmondson's another fella up in the north who's moved on into what is now known as phase 3, which is the whole business of actually settling in to adult services. And the fifth and final standard is there for us to see. And it's absolutely key that we make sure that this settling in continues to be the critical requirement it actually is. It's all too easy to have got to the stage of making that transfer that we've been referring to here in transition. But actually, this whole business of settling in and working with the multi-agency services in adulthood is absolutely vital, so that the team really is properly coordinated. Again, this is where the key worker principle actually applies to such an extent, and why it is so vital that we actually do get on and develop this further, right across the spectrum of care and support. But not just healthcare, but the whole range of support that is necessary for a young person moving into transition. And at the same stage, also must be developmentally appropriate, making sure that the clinical overview takes account of the links to the other specialisms as well. And above all, the business of frequent review and communications concerning both the plans themselves for care and, of course, the end-of-life care plan itself. One thing I think that we're all discovering, and I think we will find even more necessary in the work that we've been doing, is to ensure that GPs become more and more involved, not just in the business of looking after the family, but in making sure the young person is not only prepared for transition, but settles in once transition has taken place, including, of course, parents when and where appropriate. So what I'm going to do now is move on, having given a sense of the Stepping Up guide, and I hope that that's been helpful. I hope at the very least, if you haven't used it already, that it will give you the impetus necessary to go and have a really good look at it, and indeed about the audit tool. But I'm going to finish this brief talk this morning by just talking a little bit about the work of the task force itself. For some, this will be a reminder. For others, it will be part of something in which they're already deeply involved. But for those who need a little bit of a background, here it is. First of all, just to refer back to the point at which we initiated this, to its vision and mission. And here are the vision and mission. And I think the things that we always try to emphasize is the need to make sure that the young people themselves are able to live their lives according to their own wishes, to the extent that they can express them, while at the same time receiving the care and support they and their families, of course, and their carers actually need. And our task in the task force is to make sure that we do everything we can in our power to overcome the barriers to good transition by making sure that we build bridges between children's and adult services. And indeed, the pentagon of support that we developed to make that possible covers all 5 elements of the support we see being necessary, underpinned by health and social care, the 2 enabling elements of education and the development of a work-life balance are then all brought together in the capstone, which is to make sure that where supported living and or shared accommodation can be at home, of course, but wherever it is, that is what we aim for. And in each of these areas, there are subsets of things that need to be attended to. As I've already mentioned, as we get through into settling into adulthood, the role of the GP becomes even more vital. And of course, at the same time, all the emergency service and the palliative and end-of-life care through parallel planning, absolutely critical.
Your call has been put on hold. Please hold the line. Your call has been put on hold. Please hold.
Okay, sorry.
Line. Your call has been put.
Just hang on a second. Are we okay? Continue here. As far as social care is concerned, there are all sorts of things about the development of personal assistance and budgets, but also the development of support through psychology and the other elements of social care that make for a smooth transition in support of the healthcare plan, and the other elements, as I've indicated. To summarize the difference between adults and children's services, we've sought always to run with this aphorism of the chain, effectively, of being able to move from children's push, where we're trying to move our children on into adult services, to getting the adult services to work with children's services to actually pull, as it were, that young person into adulthood. Now, the task force has been trying to do all that for the whole of this 3 to 4 years in which we've been working, and we've had a huge measure of success in terms of the development of activities. And this map here gives a sense of the regional action groups, who are really the place where all the effort is made to support our young people. And you can see that we now have action groups right across the country. Indeed, we're now moving to another level of detail, effectively, in places like London, where we're going to have not just a single group, but 2 groups. In the Midlands, we're going to go to 3 groups. And the same is true in other parts of the country as well. And alongside that, our work with the national forums in Scotland, the Scotland Transition Forum, in Northern Ireland, the Children and Young People's Strategic Partnership, and of course the Welsh Transition Action Group. And there have been some amazing successes right the way through in terms of healthcare, the business of providing adult services through adult hospices actually taking their part, but also, of course, our own organizations that have not only their children's services, but an adult provision as well. Places like Helen and Douglas House, Martin House in Yorkshire, Jack's Place in Hampshire, and indeed Rainbows in the East Midlands. And that's just one example. Across the whole panoply of educational provision, we've seen some real breakthroughs. And the one thing that's been really encouraging about getting involved with education through the task force is that in general, each educational provision is backed up very much by a healthcare provision as well. So for example, in Yorkshire, we have Hollybank House, in the Midlands, the National Star College, in the Northwest, Beaumont College, in the South, Trelaws, and I could go on, Percy Headley up in the Northeast and so on, as well as a number of smaller organizations. But definitely this is showing that that pentagon of support, when applied equitably across the piece, actually really makes a difference. Our plan now is really to focus this next year on more and more organizations that can help to provide independent living, actually working with the other agencies. To back this up, to make this possible, we and our adult national body, Hospice UK, so between Together for Short Lives and Hospice UK, are continuing to provide right across the piece support to all the activities necessary to keep the task force going. You can see them all there, external affairs for lobbying and so on in the Houses of Parliament, something that we're going to even more concentrate on. The work that led to this whole business of the Stepping Up Guide will continue in many, many ways, as will the business of providing to parents and to the young people themselves the resources they need through the work here at Together for Short Lives. And I could go on, but the whole basis of this is that we make possible that through the task force, the necessary support that the regional groups need, that the parents need, that the young people themselves need to continue to work on their behalf to help them, not just to make the transition into adulthood, but actually to settle into it. And so there we are. That's a very, very quick run round. I hope that's given you a sense of where we are. I hope now that what we can have is a really good Q&A session that enables you not just to ask questions, but to make your own points, your own experiences felt, so that we can take those up as the seminar series continues, so that each webinar can learn on the experience of its predecessor. So we'll just take a pause while we check on the numbers of people in the chat area, and then we'll move to that as well.
Thank you very much, David. It's Lizzie here again. Yeah, if you have any comments or questions that you'd like to ask myself or David, please do type them into the chat facility. Hopefully you'll see on the side of your computer screen, and we'll try and pick those up as we go through. I should just say, I think some of you may have dialed in rather than coming to your computers, and you may have had some problems dialing in. Please do feedback to us what problems were, because we want to make sure that those don't happen in our next webinar. So please do that. But if anyone has any questions, please do type them into the chat. If there aren't any questions, then we will close a little early.
Do you want to ask about GPs? What I said is challenge with engaging GPs. What approach is being taken naturally to address GP engagement? I guess
Okay, so I think Christine May is asking a question about the challenge of engaging with GPs and what approach is being taken nationally. Did you want to take that one?
Yeah, so I'll start off with that. Thanks, Christine, and great to hear you back again, which is lovely.
Thank you.
What we're going to do here is, as part of the programme that's already been started with negotiation with the NHS, is to see to what extent we can actually run with a formal programme. You'll know that Jane White has suggested some work through a project that would actually have an engagement programme through the Royal College, and that's the way we're going to approach it initially. And at the same time, as we get that underway, we'll be asking regional action groups to see to what extent they can engage locally as well. Yeah. Very early stages yet, but definitely something we're going to concentrate on in 2018.
Yes. And hopefully linking with the Royal College as well, which would be Good. We have another question from Janet Rice, who's asking, at what point do children have to transition?
I think that's, I mean, that's one of those, how long is a piece of string, because it really depends on the child and the condition, I think, Janet. But what we're seeing is that there is a point towards the end of the educational spectrum in secondary education where it becomes more and more pressing to make that move if we possibly can. But I don't think we should say at such and such an age, because each child will have a different set of requirements. You know, Lizzie, whether you want to add
we always have said by the age of 14 plans should be in place. But it will vary from child to child, family setup to family setup, I think. We have another question here from Pam at Hollybank, asking about the third standard of stepping up, about how you start the conversation with parents about end-of-life planning.
Yeah.
This is a topic that's going to be covered in a later webinar. Actually.
Yes, I was just going to say, I don't want to steal the thunder too much, but it's a really good question, and it is something that takes a great deal of sensitivity, and there will be a lot of people attending the webinar, even today, who have had first-hand experience of that. Is there a template? Again, not exactly a template, but a process through which that is introduced is available. But again, if you don't mind, Pam, I'm going to leave that one for us to have our fuller approach to it later in the series. Yeah,
we do actually have an end-of-life guidance document that we produced it together for Short Lives, which I think would relate to any age, child, young person. And we are also developing some guidance for parents on transition, which covers this issue as well. But yeah, Emma will be addressing this in more detail later on in the series, I think.
But thanks for that. It's a very, very good question. As have all the questions so far been very good. More, please. Here we are.
So this is a question. There's more than one. This is a question from Kate about whether we have any tips on adjusting service level agreements, because adult services are reluctant to engage from 14 to 17 because they're only funded from the age of 18 onwards, which is one of the difficulties of transition.
Yeah. Have a look at that. I mean, the answer is that each one has to be taken on its merits, unfortunately. It's not one of those things you can give general undertakings about. But the most important thing is whether or not they want to engage, is that we have to keep going with them until they do. And our adult hospice colleagues and adult NHS colleagues who are already involved in this report similar difficulties about this as well, Kate. But it is something that it just simply needs more and more work to break through the barriers, really. Lizzie, any sort of thoughts from you on that one?
Well, I think it's just, I guess, part of our influencing work and awareness raising work with the commissioners. Yeah. So it's about them understanding the need to commission across, you know, from 14 to 25. It's that typical age group. I don't think there's a magic bullet, sadly.
Yeah. To Yvonne, don't worry, the whole series is being recorded as we go. So sorry that you weren't able to get on straight away for the IT difficulties, but we will make sure that everyone can access all of the webinars. We're on down to.
Yes, there's a question here.
Is that from her?
I think this one is from Yvonne. One of the difficulties that she's experienced before is about linking young people with adult services, where their needs don't meet the requirements of learning disability teams. I presume that means adult learning disability teams.
No, understood. Yeah. No, that's a very good question. We could take that one offline, I think, more specifically. But the general answer to that is that at the local level, if that young person is already within children's services, it is a question of finding that link with an adult specialist in order to make that move possible. I mean, it's something that we've been advocating ever since the task force started through the key worker principle, is to find who is that link and make it possible.
This is a long question
Yes.
from Hannah.
Yeah,
Thank you, Hannah.
Lovely, thank you, Hannah.
She's posting as a patient, and her experience of transition was mainly hospital-based. And her question is about whether we will be expanding our framework of activity to include hospital and community services, and also how we would think about the needs of siblings and families.
Yeah. No, I mean, it's a really good, I mean, it's almost an observation. It's such a good piece of work there that you produced, Hannah. So thank you very much for that. Of course, right from the start, as soon as the whole business of preparing for adulthood begins, the whole family must be involved, including the siblings as well. And this is something that I know the children's hospices spend a huge amount of time on. And from what you're saying there, that is something that we need to share with colleagues in other community and hospital-based services. I don't think there's any doubt about the need to put the family at the centre to start with. That then moves more directly to the individual as the process develops. But it never ever has to exclude anybody who is involved in it, be they a family member or indeed those who are going to take on the advocacy or the caring responsibility later on.
And just to add to that some of the research we've been involved with here, particularly the STEP project with Professor Brian Beresford, one of the key findings from that research was about the need to keep parents involved. You can't just drop them from the decision-making process. It needs to be a slow, gradual process.
Yeah. I think in work within the hospices, one of the things we forget all too readily is that when all this moves on, where are the siblings in all of this? Because so often they've been the carer, if not in actuality, certainly in support of the family during the growing up period.
There's a comment here from Christine May. Just about challenging the concept of hospices working with young people at 14, when they know that statutory services are picking this up, and in hospices families are reluctant to engage at such an early age. I guess, because they don't know whether they are going to be at the end of life and needing palliative care.
No, absolutely. No, again, that is a very good point that you made, Christine. All I can say about that is that we should try. We should do everything in our power to get this process going as early as possible, because the experience of leaving it beyond then is that, and you will know this as well as any of us, the experience of leaving it beyond then just means that it becomes even more pressing towards the time when the inevitable statutory change begins to occur. These are very good questions.
They are very good.
Thank you.
Sadly, they're not easily solved, are they?
No, but I think the fact that we're raising them today, for me, is part of why this is such a brilliant idea that Lizzie and her gang have come up with. And the fact that you're all here today just reinforces that view. And what we must do is to build our body of knowledge, one with another and across the piece, in order to make this more available to more people.
In fact, one thing we thought we might do is, as well as sharing the PowerPoints and webinar recordings, that we might put together perhaps some FAQs of some sort.
Yeah, what a good idea.
To gather together some of these questions that have been asked.
Yeah,
yep. I think that may be the end of the chat, unless anyone quickly was typing anything. We may draw this session to a close. I'll just check nothing else has come through. Okay, so I think that's the end of the session. Just a big thank you to David for being such a star, being our guinea pig on our first webinar. I hope it's been useful to all of you. I'm going to be sending out a little survey monkey for feedback on this webinar, because we do really need to learn from what could we do better next time. And our next webinar is on the 22nd of January at 12:30. We're going to be hearing from Leah Booth, who's one of our Young Avengers, at that session. So I hope many of you will join us then. Oh, another question's just come through, if we're able to quickly answer that one before I wrap up.
Yeah, no, Natalie, it's a perfectly legitimate question you make, but it doesn't mean we shouldn't keep pushing and trying. It's a very good question. And this is what Natalie's saying here, is that if adult services won't do it for all sorts of other requirements, how much more likely are they to do it for those with palliative care needs? And the answer is absolutely, it's a challenge, but it doesn't mean that we shouldn't keep fighting to make that possible.
And we are working with Hospice UK as well.
Absolutely.
To try and...
Yeah. And I think, Hospice UK have proved to be hugely supportive in this. So I think they really are getting the idea of the pull element of all of this. And, this is a question of constantly lobbying, constantly providing information, constantly raising awareness, until eventually people will get the need as being as early as it should be.
Okay, so I think we will now draw this webinar to a close. We will hopefully be speaking to many of you again on the 22nd of January for our next one. But thank you very much, and goodbye.
Goodbye. Thank you very much for attending.